Welcome to another video blog from Matthew McKenzie, care in Lewisham. This video actually covers an open forum provided by Hear Us Reach Out Challenge, a mental health project and mental health user forum and group, which is situated, their project is situated in the London Borough of Croydon, which takes place, the open forum meeting actually takes place in the Croydon Voluntary Action Centre. That's over by West Croydon. Well, basically, Hear Us is Croydon's mental health service user group, which I've mentioned before, which acts as a coordinating body to facilitate and ensure service users' involvement in the planning, delivery and monitoring of mental health services in Croydon. Now, they are funded by Time to Change, England's biggest programme to end the stigma and discrimination faced by people with mental health problems. Now, if you look closely at the London Borough of Croydon, it does have a fairly high rate of those suffering mental health difficulties. There are also challenges to mental health services, not just in Croydon, but in quite a few other boroughs around London. In fact, I would go so far as in the whole country, in the whole of the UK. And this can be down to funding, numbers game, providing services for as many as you can. Some may not actually get those services. So going back to this forum, which took place in July, and usually takes place once a month. What we had presenting there for this mental health open forum was the Psychiatric Liaison service, which is presented by Joseph from the Croydon Univesity Hospital. And we also have South London and Morsley's pharmacist Georgina Bloom presenting on medication, which is a very important factor for those who are suffering from mental health problems. Always it is good information for them to look up on medication which they may well be actually having to take. We also had support workers from Imagine speaking about updates from their services that's located in Mind in Croydon, and we had two other support workers who gave us updates on courses for those who they support being ex-offenders suffering mental health and physical health problems. But what the forum does allow is that those suffering under or actually using the mental health services need a voice to raise issues, or at least learn about service changes and deliveries, and perhaps influence and have an impact on them. This might not always work, but at least there's a forum or place to do so. The mental health forum is also open to carers like myself and the public who have an interest in mental health. Well, after being fed a lovely lunch and checking out the information section, the forum opened up with Jane White, who is the Hear Us project manager, and she chaired the July open forum. Now, Jane mentioned that they have the new booklet on the Hear Us Guide to Croydon's Mental Health and Wellbeing Services now. That's out in July. The service user groups aim to promote and educate and commute and empower for the benefit and interest of people affected by mental health issues. The booklet is free and it's colourful and easy to understand, so I recommend, if you ever get a chance, to visit Croydon's Hear Us Reach Out Challenge Mental Health Open Forum. See if you can pick up a copy. Now, since that forum was run on the 7th of July, we had a minute's silence for the 7/7 bombing victims. Next up to speak were the support workers at Whitworth Road, who provide support accommodation for ex-offenders who can and often suffer mental health problems themselves. And they spoke about the courses on offer for their clients to teach them on housing benefits, drug and alcohol awareness, and mental health awareness. And the actual work, they have work placement courses which actually at least give the clients a chance to at least get back into work. Next up to speak, we heard from a group called Imagine, who are based at Mind in Croydon, and they talked about 3 of their service user groups. They also mentioned 2 services, the befriending service, which is actually a referral only service, so that means as a GP or consultant can only refer the person to that service, or a mentoring service. I think that one could be self-referral. A member of Imagine spoke and gave his views on how he got involved in trips, going to parks or museums, and how he actually helped run lunch clubs at the Imagine project, where you could at least teach those to cook. And he feels that it's like being part of the community because he's doing more than what he used to do when he felt was lacking that support to cope with mental health difficulties. He felt that there was nice people at the project, and there was great staff, and they were approachable, and feels the service has been great for him and for others he have noticed who actually use the service as well. So going on to some questions after this presentations, which were quite good actually. We had one question. I can't cover them all due to timings, due to time limit. But we had one question saying, like, how do we access the befriender service? And I believe that they sort of, I'm quoting this, believe they mentioned that it has to be done through a care coordinator or CPN that has been allocated to yourself. That's obviously if you're a service user. Another person asked a very good question, hence that they actually did try to apply for the befriending service before, but due to some circumstances the care coordinator had moved on and they'd been allocated, I believe they'd been allocated another one, but they would want to still apply for the befriender service, and they wanted to know how can this basically continue. But I think the same answer is it's got to really come from the person's care coordinator. We had I think a very passionate criticism on the situation regarding access to these services. The person did speak, mental health survivor did speak, stating that far too few are not being offered the chance to use this service, and it's been going on in the Borough of Croydon for just too long. And the response is, I think is very important, is that eventually here are us in Croydon will actually have the commissioners who will be there to answer those questions. So it does raise some hope that the service users or those who attended the forum can raise such questions to those who fund those services. At least it gives them a chance to try to influence and at least raise issues that really strike at the heart of the problems within allocation to those services. We also heard from Barbara, who is a link worker manager, and she spoke about updates on those services that she's been, basically a link worker manager for. She also read out a statement from a service user. By service user, I mean by someone who's suffering mental health difficulty, who's using the services that provide support to a mental health user. And the service user was actually happy on receiving a card from the services that were supporting him. The patient stated that it was nice to talk to those who have an understanding of mental health. For the main event, as I mentioned before, this was on the Psychiatric Liaison service, and this was presented by Joseph Lords from the Croydon University Hospital, and this was on the mental health services provided by SLAM, which stands for South London and Maudsley, and they usually cover 4 boroughs, usually South London, South East London, so 4 boroughs, one of them being Croydon. And this service was actually, and is provided at the Croydon University Hospital. Now this service runs 24 hours, 7 days a week, and has a multidisciplinary team that works with different agencies. The Croydon Mental Health Liaison Services is based at Woodcote House within Croydon Hospital and provides service users with mental health expertise appropriate to their presenting needs. Hence, when I say needs, it's basically looking into the mental health symptoms or problems or mental health situations that the service user or client is presenting to the health professionals. Now they usually have around, I'd say, probably around 4,000 service users using this service each year. The service is heavily targeting those who have physical and mental health problems, since this has been an ongoing issue which for far too long has neglected the physical needs of mental health users. Now the function of the Croydon Mental Health Liaison Service has several purposes, these being providing services in the emergency department of those suffering mental health and have been referred to the emergency department. They also offer assessment and treatment at the Croydon University Hospital patients in inpatient settings, and they provide mental health assessment and treatment for those referred by outpatient services, those who are in the community. Plus there are doctor-led clinic services. The other roles of the Community Mental Health Liaison Services is that they provide services for those who suffer serious episodes of physical problems, hence those who may have self-harmed to the point where they've cut deep into themselves and they may need some form of surgery. They also work with colleagues to develop skills and knowledge of helping those suffering mental health problems, and they also provide advice and support and training in mental health care. To access the service, those who are involved, Croydon, the Community Mental Health Liaison Service accepts referrals from professionals working within Croydon University Hospital. But also they accept referrals from GPs, and service users can also self-refer to this service. Of course, the best way for the attendees of this open forum is to learn about the service was being presented a flow chart showing a pathway into accessing this service, which I thought was well presented. We were then told about the medical fitness issues for referrals, as I've mentioned before, for far too long. You just do not pay attention for those who are suffering mental health problems, who have acute needs, who have physical difficulties. And the thing is, service users may not always be so forthcoming when they do have physical health problems. These being, if the service user is presenting symptoms of mental problems, then they usually are referred from triage to the liaison service. And if they assess the service user and they feel that more physical investigation is needed, then they will refer to the A&E department. There's also a strong emphasis on improving service user experience through the use of PEDIC reports, matrix on improving response and meeting basic needs. And they also are looking to employ a link worker, consulting in the service, and establishing a model to develop the service further with the service user as the main focus. So okay, back to the question and answer session, which is very important doing any forum. I think one of the most frustrating things that can happen at an open meeting or forum is that people present and you just don't get to raise any questions. Even if the questions might be difficult, at least there's always a chance that a person can be heard and the questions asked. So basically, going back to these services, as I said, I can't cover all the questions, it's just not possible. But one person at the forum asked if they actually have a link with South London and Maudsley's resources in a particular area of Croydon, that being Tamworth Road. And they stated, yes, we have links across most, in fact all of the SLAM's resources in Croydon. Another good question was, how do you identify a service user through accident and emergency? And this is basically down to noting their physical presenting needs, depending on the type of mental health problem though. But usually one of them that sticks out is the self-harm problems, especially if someone has self-harmed really badly. We had a statement from a bipolar sufferer who actually was quite happy with the services that he has received from A&E. So that was a good thing. It's not always we get criticisms at the forum. Although another person stated that the wait times need to be improved at some of those services. Next up was the pharmacist, Gina Bloom. She's the pharmacist who works over at the Royal Bethlehem Hospital, which is part of the South London and Maudsley services. And she was presenting on medication, and she actually told the attendees at the forum on how pharmacists advise doctors and nurses on prescribing medicine. She talked about how patients and service users, basically how they can access medication, where they can get their medication from, that being from their care coordinator, the pharmacist, or perhaps going to the triage settings, and if they're outpatients, they can access medication from there. She noted that it is good to acknowledge the side effects, just as a warning. With medication prescribed to those suffering mental health symptoms, quite a lot of those medications do have side effects. They do affect the body in a point where perhaps someone has dry mouth or they feel really drowsy. Some side effects can be seen, others not so seen. For a few antipsychotic medications, there's been issues of weight gain, and I don't think anyone out there is saying these medications are perfect. There's always research into bettering or better the quality of medications. Quite an ongoing issue, but I'll save that for another video blog. She wrote it's important that pharmacists or doctors ask the patient if they feel any benefits from the medication rather than just coming off the medication, because they can actually look into other alternatives. For those suffering drowsiness symptoms, can take into the factor on perhaps when it is the best time to take medication, rather than taking the medication in the morning. It's better to take it late at night. She also emphasized that we are all biologically different. So it's basically about getting the right medication for you if basically you're suffering from mental health difficulties. It's always important to talk and check the best quality information on medication, which is usually provided by the service users consultant, that being trained psychiatrist or a CPN. She then talked about the types of medication. Of course, due to the time limit, this was basically more of a general presentation on medication. Now, I asked the question being that if I'm a carer, that I would like to actually remind me of how families and carers can help with medication, and what can they do if they notice problems regarding medication symptoms. And she mentioned that we can discuss this with the service user, discuss this with the patient to see if it is a problem, and then discuss this with the team, and also check the leaflets for possible causes. And the reason why I asked this question is I full well know that if someone is suffering a form of schizophrenia psychosis and the medication isn't tackling those symptoms, and the person still feels confused on the side effects, then a carer or family member will want to raise that issue. Because I do feel that it's not often that service users will be always forthcoming in chasing up side effects. Hence, when I mentioned earlier, service users are not always so forthcoming chasing up on physical health problems, let alone mental health problems. Is a tough issue. The problem with mental health is it has such an effect on the mind. If someone was clear-sighted and they knew that they were suffering mental health difficulties, which some can, depending on the mental health problems, then yes, they'll be more forthcoming in raising issues. But I feel now this is not always the case. But I do feel her answer, although it's not due to time, I'm not looking for the best answer in the world, but it's definitely a good answer. Discuss this with the service user and be diplomatic in discussing this with the mental health professionals. State your case. Georgina then showed and presented to us the list of antipsychotic medications that on the actual left side of this slide we have the older generation of antipsychotics, and to the right side the newer forms, and every one of them have side effects, some lesser than others. Regarding antipsychotics, it's also important to notice how much effect they have on the blood. There's a lot of service users would need and advise those taking such medication to have blood tests. The next bit was on we had some interesting and thought-provoking questions. So again, which is much expected, we have another question and answer session at the forum, and this is quite a long forum. I understand not all mental health forums can run probably close to 2 to 3 hours. Very good questions. I think this time I'll cover some of the questions, but not a lot of the answers. A lot of the answers were quite complex. One question was stating to the pharmacist Regina Bloom was, how are the links between the medication and genetic factors regarding the use of medication, which is a very important factor, especially if you have a relative who in your family who's suffering from a mental health problem. What is regarding that situation when it comes to medication as well. Another medication question was basically on is there such medication that can help with more than one symptom? And an interesting question was on someone been on medication for a long time, and they found that it was not effective after a while, and it was still making them drowsy, and they wanted to know what time they could actually take that medication. And I think I can remember this one. I think what she stated is that you can actually look at the time on taking that medication perhaps later at night, but she also stated that if you feel the medication isn't working, do again raise this with the psychiatrist or the consultant or the care coordinator. Don't just sit there and cope, because I think that the final outcome of anything with medications is your body. And I know some people would come off medication. It's their every right to do so, but it's also important that they seek information, consultation, in order to look at other alternatives or to lessen the impact of coming off medication where they feel the side effects is just too much to cope with. Another question was looking at food and diet and how that could affect the use of taking such medication. And a very interesting question was looking at the situation with herbal remedies, I think St. John's worts, and the factor on what's proven and what is useful, because some people just don't fully trust what's inside certain other medications. I mean, if it was completely safe, would I take such medication even if I wasn't suffering from any mental health problem? I doubt it. I highly doubt it. But it's very important questions from those who are fairly knowledgeable on that subject. They are, after all, taking medication themselves, and I think this forum does allow them the time and space to air their views, ask questions, and put forward perhaps difficult statements, but also congratulate things as well if services are working fine. And that was the end of the July 2015 Hear Us forum. I believe the next one is in September, and I do hope to try and cover that. I know I'm getting a lot busy these days, because I do want to try and go to the other 3 boroughs where the trust does provide services. But anyway, thank you for listening or watching this blog, and I'm sure I'll produce another one soon.